the opportunity to share my work today. Today I'll be presenting a bit of my research work at the Dementia and Neuromental Health Research Unit at the UK Centre for Clinical Research in Brisbane. So the cognitive problems are common in people living with Parkinson's disease, which includes difficulties with planning, problem solving, or making decisions, difficulty following conversations, difficulty remembering, problems with multitasking, difficulty finding the right word, or poor concentration. These can detrimentally impact patients and caregivers' quality of life and increase disease burden. Dementia can affect 50% of patients with Parkinson's disease in 10 years of their diagnosis and even up to 80% in 20 years. Moreover, the cognitive deficits are common even at the time of their diagnosis. The terminology mild cognitive impairment, which is known to be the transition stage between cognitively normal and dementia, have average prevalence of 30% in Parkinson's disease. And those with PDMCI have a higher risk of developing dementia compared to those without MCI. Therefore, it is quite important for us to further understand the inside of PD with MCI. So the MCI in Parkinson's disease is quite different to MCI in Alzheimer's disease. The Movement Disorder Society published a guideline for diagnosis of PDMCI in 2012. So to fulfill the criteria for PD with MCI, the patient need to have a diagnosis of Parkinson's, gradual decline in cognitive ability, cognitive deficits on either a scale of global cognitive ability or formal neuropsychological testing, and cognitive deficits are not sufficient to interfere significantly with functional independence, although subtle difficulties on complex functional tasks may be present. So the criteria lists two levels, the abbreviated level 1 with a global cognitive assessment, which can be administered in a short period of the time. The second comprehensive level 2 criteria with assessing at least 2 tests per cognitive domain of memory, visual-spatial, attention working memory, language, and executive function. So we developed a cognitive battery that consisted 2 tests in each domain, as you can see in the graph. The MCI is diagnosed when patients score below their previous score, estimated premorbid levels, or appropriate norms using 1 to 2 standard deviation, which our case used the appropriate norms with a 1.5 standard deviation cutoffs. So MCI diagnosis is met if patient failed 2 tests under each of the 5 cognitive domains. Doesn't matter whether they fail 2 tests from one specific domain or 2 tests across any other domains. So the aim of this study was to first investigate differences in demographic, clinical, and neuropsychiatric characteristics between PD with MCI and PD without MCI, then to examine the deficits in semantic fluency and associated neuroactivities in PD with MCI compared to PD without MCI and healthy controls. In our sample of 79 PD patients without dementia, the frequency of MCI was 34%. Despite the previously reported risk factors, our sample did not show any significant differences in the demographic, including age and education, except for the gender, where PD-MCI had more male patients. The PD-related measures such as disease duration and the Honenya stage didn't differ between the 2 groups. as well as the neuropsychological measures, including anxiety, depression, didn't differ between the PD with the MCI and without MCI. Using the global cognitive scales such as MMSE, MOCA, and PDCRS, PD with MCI performed significantly worse than PD without MCI. So this highlighted that our sample was well characterized and cognitive impairments can be seen as a sole symptom, not in relation to any other factors. So we quite often hear that PD patients complain about finding the right word, even at the early stage of their diseases. And there was a study in 2007 by William Gray and colleagues reported that semantic fluency task, which is generating names from a specific category, was found to be the predictor of PD with MCI. However, there's no studies investigating the relationship between the semantic fluency impairment and related neuromechanisms in PDMCI. So of those 79 patients, we were managed to scan subset of those with 13 PDMCI patients and 24 PD without MCI and 20 healthy controls. And they performed this task called a verbal fluency task inside the scanner. So the participants were displayed with instruction under the 4 conditions of rest, automatic speech, such as months of the year, alphabet, or days of the week, category generation from one category, and category switching between the 2 categories. So for example, if they were given a color and a male first name, they will switch between red, John, blue, Sam, and so on. So they verbally responded. So they were given this instruction in the scanner, in this screen, and then when they see the green dot, they verbally responded for the 11.5 seconds. And they repeated for 9 minutes, and then they repeated twice, so in total of 20 minutes. Here is a graph of average number of responses for each condition. Patients with PDMCI, which is in green, generated significantly fewer responses in both category and category switching compared to PD without MCI and healthy control. And interestingly, PD without MCI, which is in the magenta, did not show any difference to the healthy controls. When we look into the functional activities, we observed that the increased activity in PDMCI was found in compared to PD without MCI and healthy control, where in the right angular gyrus. So first we examined the main-effective group, then looked into a group difference during the category switching greater than the rest condition. So we found that the activation in PD with MCI, which is in green, was significantly higher than the other 2 groups. Then we examined the category switching greater than the automatic speech, where they generated numbers, days, reciting alphabets, and so on, to isolate the speech production. And again, we found that the activation in PD with MCI was significantly higher than the other 2 groups. Then we investigated the correlation with the outside the scanner verbal fluency performances, such as letter fluency, category fluency, and category switching with a different list of categories. The increased activation in the right angular gyrus was found to be negatively correlated with participants' performance in all 3 fluency tasks outside the scanner, demonstrating the significant association between the right angular gyrus and the verbal fluency impairment in Parkinson's disease patients. So this is a quite interesting result, as the angular gyrus is located at the junction between the occipital, temporal, and parietal lobes and is interconnected bilaterally via the corpus callosum. It is known to play a key role in semantic processing, language, complex information, and memory retrieval. So for the results that we found, there could be two possible explanations where the increased activation in the right angular gyrus in PDMCI could be related to recruitment of the contralateral non-task dominant regions with low performance in lesion aging, and clinical studies have been reported previously. Or it could be due to impaired disinhibition of the default mode network, which is known to be the resting state network, resulting impaired performance. Therefore, this study sort of highlighted that the increased right angular gyrus activity in patients with PDMCI during semantic switching suggests early compensatory mechanisms predicting the risk of future dementia in Parkinson's disease. So to further broaden the knowledge, we need to understand the heterogeneous characteristics of Parkinson's disease with MCI, investigate on other cognitive domains, including larger sample size and longitudinal studies or other brain imaging analysis such as structural or DCM analysis. More studies are needed to understand the brain regions that help the brain to compensate to exhibit normal cognition to mild cognitive impairment and to identify its impairments once patients develop dementia. So these are quite important, as to first, this can be used for early interventions to lower or prevent dementia. And secondly, finding the earliest features of cognitive involvement may provide insights into underlying mechanisms of disease progression, ultimately leading to identification of novel therapeutic targets. So I'd like to thank all our team members, supervisors, and neurologists involved in this study, as well as all the participants. And here are my contact details. Thanks for listening.
Thank you, Julia, for a nice talk. Excellent. You have provided the contact details. That would be very helpful. And a couple of questions I have here are, are there any other neurological disease where these patterns are present, or it's just specific to Parkinson?
We're not sure, because I guess the verbal fluency deficits is quite common in patients with Alzheimer's disease or any other neurological conditions where they could have a language deficit. What is interesting from our study is not only the increase in the right angular gyrus has been found first in the Parkinson's disease. So this could sort of explain how the brain compensates and connects in terms of their impairments that are specific to Parkinson's disease, that are different to any other disease. But it might be quite interesting to do the similar task in any other disease, any other neurological disease, to see whether this is a common neurological activity or that is specific to Parkinson's.
Indeed, thank you. What about the current study? Are you still working on this research project, or
yes, so
you have other interests?
Yes, so we are sort of so from this verbal fluency task, we have collaborated with a team in University of Melbourne, where they specifically look into how the speech of patients. So we have actually sent the voice recordings of our data that they have analyzed, and we are currently working on the manuscript at the moment. And also we have collaborated with teams in the US to sort of look into any other imaging analysis that we can do with this one. So including like DCM, where we can actually test whether the increased activation in the right angular gyrus is derived from somewhere else. So we can actually do a different types of analysis to look into the direction of the image activity, the brain activity. So that's we are currently working on. So hopefully we will have some more interesting results to publish.
Excellent. That looks like interesting research. You're expanding into using different technical capacities available. That's fantastic. May I thank you again?